So, Assalamualaikum sejahtera. So today I'll be briefing on these three things. Tapi it will all be in brief lah. So my first topic will be on PUS. How are we going to manage PUS in our wards? Then later on, because we are now because the COVID it's not everywhere. So we have now decided that it's not only going to be managed in a specific ward. Later on, you might have to manage your own COVID in your own ward, okay? And then I'll touch a bit on what are some of the documentation that if you have to manage your own COVID in your own ward, then they might be that. So what are some of the things that you need to do when you can occur in outpatient? So basically, why are we actually having to face all these things is because the emergence of Omicron strain of Omicron variant. So data is not, because it's fast evolving, so it has only been a few months since Omicron has emerged. So what are the things that we have known so far is that by now, after 2 years of COVID, now we know how to actually reduce the risk. You know how to reduce your risk of getting infection. So now you are wearing masks, you've got safe distancing, you've got proper ventilation, you also have got air filtration. So all these things has been taken in place. Risk has been can be reduced by doing all these things. But the thing is, with Omicron disease Omicron variant ni, dia punya case punya numbers is actually rising very fast. So doubling, macam hari ni 10,000, then after 2-3 days can goes up to 20,000, 30,000. So that is what happening to us. So UK has already underwent a few months ago. So this is what so from their experience before, we know that as compared to Delta, the transmission of Omicron is 3-4 higher. And so all these things is because of the shorter serial interval. So from one person, once a person has got symptom infective, so dia punya for a next person become infected and develop symptom very short, 3 hari dah dapat dah. So you can see the shorter serial interval from one patient dapat to another patient dapat. So very short, 3.5 days the interval. But good news is that we got our vaccine now. So with booster, you can reduce your punya risk of getting Omicron. It's only for 75% lah. But the thing is with our population in Kedah lah. So our booster coverage is up till now. A few days ago, I see that it's only about 30-40% coverage in Kedah. So that is why we are seeing more and more patients coming, because majority of those who are being admitted who needs hospitalization are those who doesn't get boosted. So majority of them are only full vaccination lah. So that's the thing. And in terms of severity, we know that even though the numbers is high, the total number of hospitalization as compared to when we had Delta variant. So when we were involved in Delta dulu, we got patient mati lah, kanan kiri semua mati lah. So now at least we got many patients, but they are not all are dying lah. But the thing is, we got patients who got COVID, but they because COVID is everywhere, so they got admitted because of penyakit lain lah. So that's the issue now lah. Okay? And so immune escape, so still can get COVID lah, even though you got boosted. Even though you got your booster dose, you can still get COVID because of this immune escape lah. But in terms of reinfection, so orang-orang yang dapat prior COVID infection and then get your vaccination, so it has been proven that they have got risk of infection is much low lah as compared to those who didn't have any prior infection. Okay. And okay, so in terms of reinfection, orang yang dapat COVID before dapat because of the new variant, so the risk is actually high. So because of all this, so the new data that we got, because you see dia punya serial interval tu from one case to another case, shorter incubation period, that is how our KKM, WHO, CDC all come up with a new guideline. So which is why dia punya incubation period tu, dia punya quarantine period tu keep on changing. So because of all this data that we got lah. So they do not make all those guidelines based on firasat, it's all based on whatever evidence that we have. So jadi from evidence lah, evidence kita tengok incubation period, dia punya infectivity period. So we find that after 5 days tu, the risk of risk of infectiousness is low lah. The CT value is low already lah after 5 days gitu. So that's how they come up with all those new guidelines lah. So basically, so the first topic will be on PUS in HSP lah. So if you all, I also received this one surat lah, one letter from Pengarah in terms of we try to standardize lah what is our consensus lah in terms of PUS mentioned in the ward. Okay, so this is actually based on the quite recent punya KKM punya guideline lah. So we did come up with all this thing, but the thing is we can't use this anymore because there is as Nafisa has put it, there is a much more recent punya guideline lah. So this is now based on your 1st of March punya guideline. So yang as I mentioned just now, we have shown that those who took vaccination boosted, the risk of getting infection is low. So this is how they come up with all this thing lah in terms of PUS punya management. So this is what tapi the thing is kalau you tengok, kalau yang KKM ni tidak bergejala, tidak kena quarantine semua ni lah. So this is so our thing is that we need to adapt to our inpatient care lah. So our patient satu you are being, those who are PUS in the ward, they are being affected lah kan. So we want to reduce the risk of infecting others. So we cannot let them without any isolation lah in the ward kan. There's a risk of infecting others. Number 2, our patient would be those who are relatively ill, immunocompromised as compared to others. So if they were to get COVID on top of their pre-existing disease, they are at risk of getting severe disease. Okay, so this is what just come out. Actually this is what we take from the recent guideline from KKM. So if you can notice here, it all depends on your vaccination status dengan some of your comorbids. So in terms of so as long as your patient is not severely immunocompromised or those who are end stage, so you only what matters is that whether they are vaccinated or not, completed these 2 vaccination ataupun booster. So if they are boosted, completed vaccination, actually basically they need to have a day 3 from exposure punya RPK. So because you know, as I mentioned just now, you punya period interval of getting infection, semua tu incubation would be about 48 hours and 2 kan. So that's why we do at day 3. So we want to catch them early. So if they were to get the disease tu, actually by day 3 you can already if you were to do RPK, if they were to be positive, can be positive then. And the total quarantine is 5 days. So you need to do an exit test lah at day 5. Day 5 would be for those yang at least got completed 2 vaccination. Okay, 2 dose vaccination. Those yang tak complete vaccination or not vaccinated at all, dia punya quarantine period will be longer, up to 7 days. Okay, so now it's only 5 and 7 lah. So basically you don't have to keep the patient for 10 days lah in your PUS day. So actually you can so it is you can actually discharge the patient from PUS in a safer ni lah, based on the latest data that we have at day 5 and day 7, based on your vaccination status. Then in terms of end stage dengan severely immunocompromised, dia punya still at day 3 and tapi dia punya exit test at day 10. So because in these people sometimes because of the immunity issue ni, and so end stage they are being dialyzed. So we don't want, if there is, they have got longer viral shedding lah, so incubation period for all this immunocompromised group. So we take it longer at day 10. Tapi it's based on case-to-case basis. Kalau patient vaccinated and relatively we can see at the case, then if we suitable, then we can suggest for at day 7 lah, as compared to day 10. Okay, so what is important that if patient we are talking about that day 3, day 5, day 7 is all about basic symptomatic patient. But if a patient were to develop symptom at any point before yang all those three, you need to do a swab test before tu lah, at that juncture, if they are symptomatic. And if you are discharging any, you can also discharge any patient lah. This is what we are doing now. Kalau patient stable, semua tu you can discharge for, and you can arrange for PKD lah. You can inform PKD atau sikit. I think PKB or CAC lah, this is what has been done. Okay. So what do we mean by immunocompromised? So this is based on the KKM guideline Annex 2. So the thing is, in summary lah, those who are on hydrosteroid, those who are undergoing chemo, recent transplant, ataupun HIV not on treatment. So those are in very immunocompromised state. So this is on PUS. So I think this latest guide ni will send to Mengarah, then can be distributed to others. Okay, now managing COVID in general. So I think there's a recent discussion, and it has been agreed in general that you have to be ready that you need to manage COVID in general. So we can't keep on expanding our COVID ward forever lah. So once we expand COVID ward, then you need to shut down other services, and the care of the whatever major what is the main disease might be compromised if they are kept in COVID ward. So it's not only happening here, so it has happened before lah. So memang majority of cases for being admitted for COVID are actually incidental punya COVID. So meaning that masuk untuk sakit lain, then buat pre-admission ke apa test, then turn out to be COVID. Okay. So basically, so we are not closing our COVID ward, but we are actually this is what has been decided lah. So there are cases that we think are suitable that can be kept in your own ward. So these patients are the so-called incidental COVID lah. So katalah masuk because appendicitis ke apa lah, RTK positive. So but otherwise, patient maybe has got no symptom at all, which is Cat 1, ataupun mild symptom lah, some sore throat ke, UTI ke, maybe that Cat 2. So and doesn't require oxygen. So those are the patient that is suitable to be managed in your general ward. Okay, and in the ward, satu lagi, there is no AGT procedure that's been done for the patient. So these are the safe patient that can be managed in your own ward. Okay. Okay. So, but as you know, this patient can actually progress ataupun deteriorate. So later on we come up with a guide when actually to suspect deterioration baru semua lah. So basically, when you need to refer for admission to COVID ward is when there is suspect progression of the COVID into COVID pneumonia, meaning that Cat 3 and above. So Cat 1, Cat 2 is not pneumonia yet, it's only COVID infection. Tapi bila dah Cat 3 and above, is actually you got pneumonia already. Okay? When there is Cat 3 ataupun you need oxygen therapy lah for whatever reason. So because whenever a patient needs oxygen therapy, there's a risk of dissemination lah, because aerosolization lah. Okay, so basically Cat 3 and above, you need to refer to us for admission that need to be warded in a COVID ward lah, proper COVID ward. Otherwise, they would be relatively safe to be managed in your own ward. Okay. Okay. So what are your infection control lah? What are the things that you need to take into precaution when you are actually managing a COVID patient? So these are some of the main thing lah. So the basic thing that you need to do when you are managing a COVID patient. So actually KKM has come up with a recent guide lah on what are your PPE, what is your infection precaution. You can actually download from KKM website. Is Annex 8. So the main thing is that if possible, use a disposable equipment so that you have to use a dedicated equipment for them. Okay. And in terms of PPE, jadi based on the latest guideline lah. So dia ada dua pula, low contact risk, high contact risk. So low contact risk ni macam ambil BP, macam ambil temperature, ambil vital signs lah. Those sort of thing that would consider as low contact risk. High contact risk ni yang ada lah when you has got more prolonged exposure to examining patient, that will be high contact risk. So this is the PPE yang suggested. So what is compulsory here would be N95, your eye protection, glove, and also gown. So these are the options lah. Yang beza antara your low contact, high contact, later on would be in terms of your gown lah, plastic and long sleeve. So it's no more macam rigid as of now lah, because over the years we have learned what are the risks of contracting COVID, what are the essential PPE that you need to wear lah. So what we are doing now is actually overdue. So these are what are the essential things that has been proven to actually reduce the risk of infection lah. Okay. And after every time kau ni kena discard all PPE, okay, perform hand hygiene. This is the fundamental things. And because your patient are Cat 1, Cat 2, so they are not requiring oxygen. So please make it mandatory for them to wear a 3-ply mask at all time. So pakai mask. If they are coughing, then kena ajar cough active. Ensure good ventilation in room. So we have done in 4C, 5C. Before we so in 4C, 5C, when we turn the 2 rooms into COVID room, so we had help from Agenta lah. So they help to, they install some exhaust fan to increase the ventilation. Then in the room pun, with Agenta punya advice to make the ventilation better, dia ada macam fan. You put the fan dekat window, macam flat lah. You put fan towards the window. So but that is actually to improve the ventilation, so that the air keeps on going up lah. So this one you can get Agenta punya help lah in terms of what are the things that you can optimize in terms of ventilation. And so unit number of healthcare worker ni penting. So tak boleh lah masuk ramai-ramai. So maybe one specialist lah, macam tu lah. BHT, okay, you kena letak kat green zone tu. Then ni lah cleaning patient room bathroom. Ni you kena reduce dia punya whatever viral load lah, the formats. So at least twice per day. So now also dia punya quarantine period pun dah shorter, 7 days juga kan. So if the patient is well but still within that quarantine period, so they can be home quarantine. So inform I think CAC for home quarantine, CAC PKD tu. But if they are not suitable for home quarantine, betul lah, ada banyak isu lah, require nak monitor stiker, ada signature, home is not suitable ke apa, you can actually refer to PKRC lah. So PKRC we do have one dekat Jitra. But the thing is in terms of PKRC, as long as they are independent lah. So because it's a day one kan, so day one tu dia kena keluar berjalan di toilet semua tu. So the patient has to be relatively stable dengan ADL independent. That's the main criteria for them to get into PRC. Okay. This one pun the isolation criteria lah, based on the latest law. So is you can 7-10 days lah. And stage would be longer scale because they are at risk of prolonged viral shedding as compared to the others. Yang immunocompromised tu, we go up to 20 days. So these are the one, ataupun I'm talking about Cat 1, Cat 2 lah. Kalau Cat 3, Cat 4 tu, you can go up to 10 to 20 days. Itu based on severity. That one we decide case to case basis lah. Yang masuk ICU semua tu, some we do the isolation only after 20 days because of the severe disease. Okay. Visitors, caregivers, so strictly not allowed. Okay. Tapi kalau these are some of the things that happen dekat our COVID ward. The caregiver is also COVID positive nak jaga jugalah. So they are allowed to jaga, tapi dia macam jaga as a caregiver lah. They have to sign a few things. Dan ada sesuatu yang caregiver tu negatif, tapi they willing to take the risk. So they actually have to sign a form lah. There is such a form lah that exists. So boleh, then you can just refer to medication guideline. And next we are going into this is part of the rational use of N95. So when basically it's mandatory when you are providing care to any of your COVID-19 patients, SARI or US patient, that is mandatory, or you performing AGT ataupun high risk of patient of high flow semua. Okay. And this is KKM punya policy lah. There's such a thing of extended use N95 ataupun single use N95. So basically if you are attending a COVID patient, SARI patient model, US patient is a single use, lepas pakai buang. Tapi extended use is when you pakai 1 mask per shift lah, prolonged use lah of N95. So these are the less pakai sampai soil ataupun wet ataupun up to your per shift lah for all the other patients who are not COVID, not US, not SARI lah. So this is KKM policy lah. Okay. So that's all on your COVID national allowance lah. Next will be I'll touch a bit on mortality lah. So kalau you perasan sekarang ni, we keep on talking about death due to COVID ke death with COVID. So basically death due to COVID is actually death which is death directly due to COVID itself. Okay, death with COVID is that death which is due to something else tapi patient ada COVID at the same time. Okay, so contohnya lah, this is the usual thing lah, dapat myocarditis because of the COVID, ada severe COVID ke, semua tu is all under death due to COVID. Tapi kalau death due to COVID, patient dapat patient well in the ward tapi suddenly dapat myocardial infarction. So it's myocardial infarction with COVID. Lepas tu patient came in with NDA, ada head trauma tu, and then buat COVID test positive, but you assess that X-ray wise, meaning that lung wise is not very bad COVID tu. So you can put the death, the cause of death is actually head injury with COVID-19. Okay. This is some okay. You might not have to see sekarang ni lah, tapi these are some of the things that we have been dealing with COVID ni. So banyak kali kena corrected lah by our forensic lah. So dia cakap jangan letak severe lah, jangan letak severe COVID ke apa ke, because it doesn't bring any meaning lah in terms of your death in your death cert. So COVID-19 is adequate lah. It's not severe COVID lah, okay? And another thing is yang tulis COVID-19 infection, because COVID is actually SARS-CoV punya infection causing COVID lah, ya. Okay. Sepsis, so kalau cakap sepsis due to something lah. Macam tadi cannot write that as COVID-19 pneumonia with multi-organ failure. Is not, you don't have to write that multi-organ failure as part of the cause of death. Okay. That one is your ni lah, you letak what is the cause of death, whether it's death with COVID or death due to COVID. Then the next part is that this is a recent database lah. I think in November, October, they started to introduce this database. So where each death you need to fill up in this database lah. So it's under CPRC hospital system. So I just show lah what are the things inside the system lah. So basically this is the main database lah. These are, so basically this is all the patients lah, which is being entered in the database. And what are the details that we need to be? The first thing that they'll ask is actually what is the death, type of death, whether due to COVID or with COVID. So these are some of the things that they want to be. Bila test positive, notification date to PKD-nya tu is usually when the test is done. So that is the date that we take. When symptomatic or not, with the staging. Summary, we're not really in details, just summarize what is, so that as long as they understand, summarize as long as they understand what is your COVID stage, or if it's due to non-COVID cause, how severe is that non-COVID tu, and how do you usually kata yang COVID tu tak severe sangat. Okay, so that's all. So any question?